Breast cancer is the most common form of cancer in women other than skin cancer. Therefore, primary healthcare professionals should encourage all patients, including women over 50 years of age, to be breast aware in order to minimize delay in the presentation of symptoms. GPs should refer any patient whom they deem to have a suspicion of cancer regardless of age. There are common signs of breast disease to always look out for, and you must have knowledge of these in addition to the information provided within this presentation. These signs include axillary lumps, ulceration, nipple eczema, changes in skin texture, nipple retraction, and the presence of an abscess. But patients will commonly present with either breast pain, breast lumps, or a combination of both. The following steps are designed to help aid your decision for referral to specialist care. If the patient presents to you with breast pain, take the following measures. Examine for any discrete breast lumps. If the breast pain is mild or moderate, reassure the patient and observe and follow current breast pain management guidelines. If the pain is severe and diffuse, conservative management is adequate. However, if the pain is severe and localized, refer the patient immediately. If the patient presents to you with a breast lump, follow these guidelines. If no lump on examination is found, reassure the patient and reassess at a later date. If it is a discrete lump, refer immediately. If you detect a lump which is asymmetrical, nodular in nature and dominant, also known as dominant asymmetric nodularity, and if the patient is greater than or is 35 years of age, refer immediately. If you detect dominant asymmetric nodularity and the patient is less than 35 years of age, your decision to refer will also be determined by any breast cancer history. If the patient has a strong family history of breast cancer, refer. If no history of breast cancer is present, review the patient in 6 weeks, and if the nodularity has disappeared, reassure and monitor the patient. However, if it is persistent, refer her to specialist clinic care. The patient may also present to you with a history of nipple discharge. If this is the case, and they also have a lump, follow the previously mentioned steps in regard to this. However, if there is no lump and the patient is greater than or is 50 years of age, you must refer her. If she is less than 50 years of age, your decision to refer is determined by the nature of the discharge and whether it is unilateral or bilateral. For example, does it affect one breast or both? If unilateral and the discharge is either bloody in nature, large in volume and/or persistent, refer her. If bilateral and blood-stained or serous, again refer the patient. If, however, the fluid is non-bloody or coloured, the volume of discharge should be observed. If the volume is great, make sure she is referred. If the volume is small, reassure the patient and monitor her via your clinic.